Hydrocele. This is a collection of fluid in the sac surrounding the testicle. Is there a permanent cure? I don't want to just drain it and have it come back. You're right. While we can aspirate the fluid with a needle, it almost always returns. The permanent cure is a hydrocelectomy. It's a minor outpatient surgical procedure where we remove or plicate the sac itself so the fluid can no longer accumulate. It takes about 30 to 45 minutes. Symptoms and diagnosis. The primary symptom is a painless swelling of one or both testicles. You might feel a sense of heaviness or notice the swelling is larger in the evening than in the morning. While usually not painful, if the area becomes red or acutely sore, you should see a doctor immediately to rule out an infection or a twist. Treatment and surgical solutions. In adults, hydroceles rarely go away on their own. If it's small and doesn't bother you, we might just monitor it. However, if it grows or causes discomfort, the gold standard treatment is a hydrocelectomy, a surgical procedure to remove the fluid sac. Some ask about aspiration, using a needle to drain the fluid. While less invasive, the fluid almost always returns, which is why surgery is the permanent solution. How the surgery is performed. Here is what happens during a hydrocelectomy. Anesthesia. You'll be under general anesthesia or a spinal block, so you won't feel a thing. The incision. A small incision is made either in the scrotum or the lower abdomen. Draining. The surgeon drains the fluid from the sac. The repair. The sac itself is either removed or folded back and stitched to prevent fluid from building up again. Closing. The incision is closed with dissolvable stitches. The whole process usually takes less than an hour. Post-surgery do's and don'ts. Recovery is usually straightforward, but your do's and don'ts are critical for a complication-free healing process. The DO's. Do wear a scrotal support or jockstrap for 1 to 2 weeks. This reduces swelling and pain. Do use ice packs, 20 minutes on, 20 minutes off, for the first 48 hours. Do take your prescribed pain medication and finish any antibiotics. The don'ts. Don't lift anything heavy, over 10 pounds, for at least 2 to 3 weeks. Don't engage in strenuous exercise or sexual activity until your doctor clears you, usually around 3 to 4 weeks. Don't submerge the incision in a bathtub or pool for at least a week. Sticking to showers is safer. Conclusion. Most men return to light work within a few days. If you notice a high fever, excessive bleeding, or swelling that gets worse after the first few days, call your surgical team right away. A hydrocele is a very treatable condition, and surgery is a safe way to get back to your normal life. Thanks for watching. A disclaimer, this video is for educational purposes. Always consult your healthcare provider for medical advice.